Good evening and welcome to another edition of the Borno Health Update. I am your host, Ibrahim Amarawa, here to share light on the remarkable stride being made in our healthcare sector under Governor Zulum's visionary leadership. Today, we focus on transformative efforts spearheaded by Professor Baba Malam Gana, the Commissioner of Health and Human Services, Borno State, who is driving innovations and resilience in our healthcare sector. The Borno State Minister of Health is working tirelessly to achieve the objectives of Governor Zulum's 25-year development plan. A series of programs such as training sessions, workshops, and seminars are being conducted regularly to ensure every sector of the healthcare system becomes self-sufficient. With the support of Joyfingo and other partner organizations, Borno State Comprehensive Emergency Obstetrics and Newborn Care (CMONG) organized a day workshop to review the findings of the assessment of all aspects of healthcare delivery. During the event, the Commissioner of Health emphasized to participants the critical importance of the data generated through these initiatives.
Emergency obstetric and newborn is key when you assess any healthcare performances. Borno State has been doing a lot. Unfortunately, we are amongst the 172 local government areas in Nigeria that have got the highest burden of maternal mortality and newborn mortality. These 172 local government areas contribute over 55% of the maternal death in Nigeria. So it's dragging Nigeria's name downwards all the time. And by implication, Nigeria is, you can equally say that Nigeria has the highest burden of maternal mortality in the world. We are only better than South Sudan and Chad, and therefore Nigeria's figures are really alarming. As a matter of fact, every fourth woman that dies as a result of maternal issues in the world is a Nigerian. So it's really something that all of us here are carrying a lot of heavy weight on our shoulders to see what we can do to reverse this trajectory. If this trajectory is left unchecked, unfortunately, it will be catastrophic because Nigeria is heading to become the third most populous country in the world by the year 2050. So you can imagine at that time, we may be faced with highest maternal mortality ever seen in the world. So it's incumbent upon us to take actions so that we can begin to bend this graph downwards so that our maternal mortality and newborn mortality could be crushed. We're very grateful to Jamaica for this assessment that was carried out. As enumerated by the Chief Medical Director, they have been to every nook and corners, crannies of Borno State to, get us those information that is required. JAPICO was supported by the defunct UNICEF, and they provide all the technical assistance to the Federal Ministry of Health so that this assessment could take place. Later, I'm sure you will understand how the assessment has been carried out. There were two structures that they looked at. Part one was the infrastructure, the supplies, the human resources for health, as well as data. These are very key. And then the second component looked at the capacity of those who are involved in delivering this maternal and neonatal care in our respective institutions. So this is crucial. And then the other aspect that I've just seen the secretary of the Borno State Emergency Medical Supply and Ambulance System looking worried because I've not mentioned about emergency transportation. They also assessed emergency transportation in this assessment, which you will learn later. So what you're going to be tackling today is very serious, is very important, and we should pay attention. That's why we have the Chief Medical Director of Borno State Hospitals Management Board, who is a renowned obstetrician and gynecologist, who will be with you throughout today to ensure that this message is propagated from here to all the 27 local governments.
Beyond the significance of the data, the Commissioner reiterated that a major task lies ahead, doubling efforts to eliminate maternal mortality in Borno State.
We have to work on this assiduously to ensure that this information that is going to be available to us is made best use of. Borno State government, as most of you are aware, has been looking at maternal mortality and newborn mortality since January last year in contextually, when we had the first commissioners of health of the Northeast here in Maiduguri convened a meeting, and the theme of the meeting was maternal mortality reduction, practical steps, which was well attended, and this catapulted into a person who came to present on the findings in Tanzania and how they were able to crush maternal mortality by 75%. Yes, it was 75% maternal mortality reduction in Tanzania and 50% in terms of newborn mortality. So it was serious, so we took a study tour in conjunction with Federal Ministry of Health and National Primary Healthcare Development Agency. 10 of us went to Tanzania and saw it for ourselves, and we were convinced that we could do the same, especially in Nigeria, particularly for me in Borno State, where maternal mortality, at that time, I knew it was high, but I didn't have the data to back it up. It was based on anecdotal evidence. But now federal government has brought out the data, and rightly speaking, we are number 3 in the country. This stretches from Bayo, Biu, Howell, Shani, Damboa, Kaga, MMC, Jere, Kondoga, Mafa, Rubio, Monguno, and Damasak. These are the 13 local governments that have got the highest maternal mortality in the state. And as pointed out earlier on, since January last year, or even before then, we've been addressing the issue of maternal mortality and how to look after our women who are pregnant. At any point in time, there are 400,000 women in Borno State that are pregnant. So we had to plan everything accordingly. His Excellency graciously approved the free maternal drugs, where all the women who are pregnant are receiving free drugs throughout their pregnancy. And furthermore, along the way, he also approved free cesarean section. This is something that has not been done in Nigeria before, as far as we know. And the federal government was watching us closely. And recently, they've now given the go ahead to for women to get free cesarean section, as well as complication of cesarean section or complication of delayed delivery, vesicovaginal fistula, to be treated free of charge. For this, we're immensely grateful to the Minister of Health, Professor Muhammad Ali Pate, who saw the wisdom and convinced His Excellency the President on why Nigeria should invest in this aspect of healthcare. We have signed on with the NHIA 4 hospitals within Borno State at the moment. State Specialist Hospital is already enjoying direct reimbursement for every cesarean section they've done. General Hospital Monguno is also the same, as well as General Hospital Biu and General Hospital Goza. I've been assured by the ES of the Executive Director of the National Health Insurance Agency, if I provide the necessary data, he will, sign on board more facilities in Borno State, because I argued that we have certain local governments that are affected, and not only that, we've had this insurgency for the last 15 years, and therefore we should be considered a special case. So we're working assiduously with the Hospitals Management Board to provide the necessary information so that we can convince at the federal level where these issues can be done. We also seen His Excellency signing into law the Drugs and Medical Supply Agency, which is geared towards a reduction of maternal mortality, and as well as other things. Of note, recently I was on a Zoom meeting with an organization in Switzerland who are helping Nigeria to bring into Nigeria, in fact it's already here, the heat stable oxytocin. So this will be delivered to Borno State shortly, and that will mean that every local government area without the facility of refrigeration can equally store and use cytocin, which is heat stable. As enumerated earlier, we've also introduced the Safer Birth Bundle of Care. Already, there are 4 facilities here in Maiduguri.
In his address of welcome, the Chief Medical Director, Hospital Management Board, Professor Bakar Kullima, emphasized the significance of the workshop and urged participants to focus.
From the speech, you now know that if the interventions are anything to go by, then Governor State will be thinking of zero maternal mortality. But it's a dream we're envisaging. And if all hands are on deck, including our foot, I think we'll achieve a significant reduction, even if not zero, in their cost. So thank you very much, Lord Honorable Commissioner, for this commitment and your presence. If you see the agenda, they say we'll go for children. But before that, we want the Honorable Commissioner to now unveil.
Additionally, Professor Kullima explained the rationale behind conducting this assessment and objectives they aim to achieve.
Actually, this program is a dissemination meeting on the health facility assessment that was undertaken into our secondary healthcare facilities, particularly to look at the comprehensive emergency care as well as comprehensive neonatal care. We are talking generally that we have an increase in maternal mortality and neonatal mortality. So the federal government, through JAPIGO, sometimes last year undertook this assessment visit to all our secondary health facilities in the 27 local government areas. We selected one in each of the local government areas, and the findings from these structures, and they are carried out in three forms. First one is to look at the infrastructure in where we are conducting delivery as well as where we are caring for our newborns, as well as the human resource for health, in those facilities. And then the second component also looked at the competency of the staff that are in those facilities. It's not the number, but we are looking for the competence. And then the third one is also the bill of quantity for the general infrastructure, as well as power and other infrastructure needs in those facilities. So this is what was carried out, and today we have had, the findings from those assessments. For us to go back to the drawing board, any day you carried out an assignment, there is nowhere you are going to have 100%. But the picture that we saw today is a wake-up call to all, that in spite of all the effort government is making and the various interventions that are put in place, but this assessment really showed us that we have a very long way to go, and will give us a guide as to what specific intervention are we going to put in each of those areas to address. Since it was carried out across all the 27 local government areas, no two local government will be the same. So it was based on the outcome, and then we now tailor the interventions that we are going to put into those, secondary healthcare facilities to see that we achieve a reduction in our neonatal.
In another development, the Health Commissioner received a delegation from Helen and Keller International and at his office. The Commissioner took time to provide them with the further details about the effort made by the Ministry of Health with the support of partner organizations to eliminate maternal mortality and addresses the long-standing challenge of malnutrition among children.
All these partners either put the funds in one basket or defined a sustainable program, then our people will have a sigh of relief. So I felt that we have a local program which Tom Brown, which is known for many years, and already being produced by FAO here in Maiduguri, and it's also available in some of the supermarkets. And we know it's very helpful in the treatment of relapse of severe acute malnutrition, and also in the treatment of MAM or moderate acute malnutrition, and of course mild malnutrition. And it can also be used by lactating women as well as pregnant women. It's a big problem, malnutrition, as a result of all the insurgency for 15 years. People were not going to their farms, and therefore the malnutrition program is exaggerated. Equally, it's not just Borno State, but in the northwest as well. There's a huge problem of malnutrition. What is to bear in mind is that those with severe acute malnutrition, if care is not taken, it will affect not only their growth, which leads to stunting, but also their mental capacity is going to be affected. So especially in some parts of the state, you will see the situation where the children will not be able to go to school. Even if they do, they're not performing well. So the future nurses, engineers, what have you, will not be there. So it will be very skewed for that part of the country. So therefore, we came up with this program of upscaling into industrial scale the production of Tom Brown. We partnered with FAO, which is part of UN, as you know, and we had a a meeting at the UN House in February, where His Excellency the Executive Governor went to the UN House and participated in the meeting. Most of the UN agencies attended because it's happening right inside their own house. And therefore, now we're moving to the next step, which is to be able to bring all the interested partners. At that meeting, World Food Program was completely with us. UNICEF was here even yesterday, and they said, they are going to fortify the product. And ours is going to be unique because we are going to have plus fish. Yeah, plus fish. So, which means recovery will be faster for the children, and hopefully the mental aspects will also be less, with this. I will, if you like, I can invite you sometime this month. I'm about to, agree with the partners when it's going to happen, but it's going to happen in Abuja because most of the partners are in Abuja. So I go to them, so that, yeah. So therefore, the head of OCHA who sat right here said, look, there will be no need for, UN to import any of this product. We can just track it from here to Chad and other neighboring countries. So, and there's a huge, value chain in terms of agriculture. So we believe this is doable. Firmly believe that we can do this, and we can even, visit China to see the machineries that can produce, turn it around into industrial scale. So we've done a lot of homework on this, and I would like to ask you to please join, because this is really crucial. You're not only helping Borno State, but honestly, even Lagos has got cases of malnutrition. So it's
everywhere.
Yeah, it's everywhere, and we're also running another program here, Save a Bundle of Birth Care, which is supported by Norwegian government, where we are crashing the maternal mortality in the state. It's quite a serious problem, which I realized when I joined, that Borno State is number 3 in Nigeria in terms of maternal mortality. And Nigeria contributes 30% of maternal death in the world. So every 4th woman that dies in the world from pregnancy related is from Nigeria. I really felt bad and ashamed that a country with, big financial might, at some point in time, Nigeria is number 1 in Africa. So therefore, we came up with this program, which has been done in Tanzania, and is crashed maternal mortality by 75%. Yeah. They have produced 150 papers. The last one is in the New England Journal of Medicine, where they said they crashed it by 75%, and newborn or neonatal mortality by 45%, and fresh stillbirth by 25%. So it's really, solid. They produce 40 PhDs in this process. Wow. Everything is researched. Whoa. Yeah, 40 in conjunction with Stavanger University in Norway. If you go and see their research facilities, like in Europe, fantastic. So the point is that, we have to take some things seriously. And thank God, this government is putting in a lot of funds into healthcare, including maternal mortality innovative initiative program, which we've already onboarded Borno State.
The Helen Kellen delegation, led by its head, outlined the activities they are implementing in Borno State and pledged to strengthen their support for these health and nutrition programs.
It is already across communities and IDP camps. So far, we have managed over 1,200 TB cases, trachoma cases across 8 LGs that we have started. You are aware, sir, that 17 LGs are actually endemic for the blinding trachoma, and we are able to finish work in 8 of those LGs. Despite so many challenges around security, displacement, and other peculiarities, we are able to break the barriers and achieve that milestone. We have also, after our last visit, trained additional surgeons, 3 of them, to add to the pool of surgeons that we have to be able to stagger the activities and achieve a very quite large number within a specific donor timeline. Today we are here again to introduce another intervention with funding from the NFund. NFund is another donor to the Linkela in the NTD's programming. From this year, we'll start hydrosis surgeries. Hydrosis surgeries as part of LF elimination strategy. You're aware that as a country, Nigeria has gone far in LF elimination, lymphatic filariasis. So there is a project called Reaching the Last Mile to be able to sweep the remaining MDS assessments and as well as morbidity management. So as part of that, we are coming to support the state with initial 200 surgeries from now to the end of the year. We hope, by tradition, the donor usually add more numbers, and in as much as we're able to achieve the initial target in good time. So we are hopeful that once we are done with this initial 200, more surgeries will be conducted. Already we have integrated the case search into the TT case search, and we have a number of cases on ground. So anytime from now, the state entities program will call for planning meeting, and the remaining activities will follow. From now to the end of June, we should be able to finish at least 100 of those cases. We have also maintained support around schisto MDS. This year, we have assessed more LGS, and we are scaling from 13 to 21 LGS. We have conducted security assessments, and as we are aware, we are largely using local content, including the use of resident independent monitors. Those are unemployed graduates that we used.
Thank you for joining us. Stay tuned for next week's update, where we will explore more innovations in the healthcare sector. This is Ibrahim Amarawa reminding you, health is wealth and Borno is rise again.